A client with Parkinson's disease begins choking while eating soup. The aide should first A. Offer water immediately. B. Perform abdominal thrusts. C. Encourage the client to cough forcefully. D. Try to remove the food with fingers. Answer: C. If the client can still cough, allow them to do so to clear the airway before intervening further. During perineal care, a client suddenly complains of burning. The aide should A. Stop immediately and report it. B. Add more soap. C. Continue quickly to finish. D. Apply powder to the area. Answer: A. Burning may signal irritation or infection. Care should be paused and reported to the nurse. A home health aide observes dark, tarry stools in the commode. This could indicate A. Dehydration. B. Internal bleeding. C. Constipation. D. Medication overdose. Answer: B. Black or tarry stools may be caused by gastrointestinal bleeding and must be reported urgently. When changing a sterile dressing, the aide accidentally touches the inside of the gauze. The correct action is to A. Continue and cover the wound quickly. B. Report to the nurse and get new sterile supplies. C. Use the same gauze carefully. D. Pour alcohol on it. Answer: B. Once sterility is broken, new supplies must be used to avoid infection. The client with congestive heart failure gains 2 kilograms in 2 days. The aide should A. Record it but take no action. B. Report the change immediately. C. Encourage extra fluids. D. Stop medication. Answer: B. Sudden weight gain may indicate fluid retention and heart failure worsening. If a confused client begins to undress in the living room, the aide's best response is to A. Scold gently. B. Laugh to lighten the mood. C. Redirect to their bedroom calmly. D. Ignore the behavior completely. Answer: C. Redirection is the most therapeutic response for confused or disoriented clients. The most critical reason for reporting minor skin redness on a bedridden client is A. To document care properly. B. It may develop into a pressure ulcer. C. To get more supplies. D. To prove observation skills. Answer: B. Early intervention prevents pressure ulcers, a major home care safety concern. When assisting a client with oxygen therapy, the aide should never A. Check tubing for kinks. B. Place oxygen tank near open flame. C. Ensure nasal prongs are secure. D. Monitor for skin irritation. Answer: B. Oxygen supports combustion. Flames or smoking near oxygen pose fire risks. A diabetic client reports tingling and numbness in the feet. The aide should A. Massage the feet firmly. B. Report to the nurse immediately. C. Apply lotion between the toes. D. Encourage walking barefoot. Answer: B. Tingling indicates neuropathy, which requires prompt medical attention. The client's care plan requires ROM-X3 daily. This means the aide should A. Encourage rest 3 times a day. B. Perform range of motion exercises 3 times daily. C. Reposition every 3 hours. D. Record meals daily. Answer: B. ROM stands for range of motion exercises to maintain joint flexibility. Which of the following actions violates client privacy? A. Speaking about a client's condition with the nurse. B. Discussing a client's case in an elevator. C. Updating the care log. D. Asking a nurse for instructions. Answer B. Public discussion of client information breaches confidentiality under HIPAA. When cleaning hearing aids, the HHA should avoid A. Using mild soap. B. Using alcohol or harsh chemicals. C. Checking for battery life. D. Drying carefully. Answer B. Alcohol can damage internal components. Use only approved cleaners. The best way to assist a client with mild dementia in remembering daily tasks is A. Leave them alone to practice memory. B. Create a structured, labeled routine. C. Quiz them frequently. D. Use punishment for forgetting. Answer B. Structured routines reduce confusion and enhance memory retention. A client's family insists on giving herbal supplements not prescribed. The aide should A. Encourage them. B. Report to the nurse immediately. C. Mix it with the client's medication. D. Ignore it. Answer B. Non-prescribed supplements can cause dangerous drug interactions. When a client with limited mobility complains of leg pain, the aide should A. Massage deeply. B. Apply ice immediately. C. Stop activity and report it. D. Encourage movement to loosen muscles. Answer C. Leg pain could signal a blood clot, DVT, avoid movement and report. During catheter care, if the bag is found above bladder level, the aide should A. Leave it. B. Lower it below bladder level. C. Empty it immediately. D. Replace it. Answer B. The bag must remain below bladder level to prevent urine backflow and infection. The client begins to cry during bathing, saying, "I feel useless." The best aide response is A. Don't cry, you'll feel better. B. Tell me more about how you're feeling. C. Let's hurry and finish your bath. D. You shouldn't feel that way. Answer B. Open-ended, empathetic communication supports emotional well-being. If a client refuses medication, the aide should A. Try to hide it in food. B. Respect refusal and report to the nurse. C. Tell them it's required. D. Give it later without asking. Answer B. Clients have the right to refuse. Medication decisions must be reported, not forced. A home environment with scattered rugs and dim lighting presents A. Comfort benefits. B. Fall hazards. C. Privacy advantages. D. No concerns. Answer B. Poor lighting and rugs increase fall risks, especially for elderly clients. Gloves must be worn when A. Making a bed. B. Reading a care plan. C. Handling body fluids. D. Feeding a client. Answer C. Gloves are required to prevent exposure to infectious materials. A client with COPD should be positioned A. Flat on the back. B. Semi-Fowlers or upright. C. On the abdomen. D. With legs elevated. Answer B. Upright positioning helps expand lungs and improve oxygen exchange. A client begins to faint while standing. The aide should A. Catch them abruptly. B. Guide them gently to the floor. C. Run for help immediately. D. Shake them awake. Answer B. Supporting the fall prevents head injury and maintains airway safety. Before assisting with meal preparation, the aide must always A. Wear gloves only. B. Wash hands thoroughly. C. Check temperature of oven. D. Sanitize floor. Answer B. Hand washing before food handling prevents contamination. A client's blood pressure is 88/54 mmHg. The aide should A. Record and wait. B. Recheck after 5 minutes and report. C. Give salt water. D. Ask the client to sleep. Answer B. Low blood pressure may be dangerous. Rechecking ensures accuracy before reporting. Which behavior demonstrates cultural sensitivity? A. Forcing one's own habits. B. Asking about clients' cultural preferences. C. Assuming all clients follow similar customs. D. Ignoring religious needs. Answer B. Asking respectfully promotes understanding and culturally competent care. When emptying a urinary drainage bag, the aide must A. Pour contents into the sink. B. Measure and record the output accurately. C. Dispose of urine without measuring. D. Touch the spout to the measuring container. Answer B. Accurate recording helps monitor kidney and fluid balance. A client begins having a seizure during feeding. The aide should A. Place a spoon in their mouth. B. Move items away and protect the head. C. Hold the client tightly. D. Give water after seizure. Answer B. Safety is the priority. Protect from injury, never force objects into the mouth. Which of the following is an early sign of infection? A. Decreased temperature. B. Elevated pulse and redness. C. Slow breathing. D. Low energy only. Answer B. Infection often presents with redness, swelling, and increased heart rate. The best way to prevent back strain during care is to A. Keep legs straight. B. Bend knees and lift with legs. C. Twist at the waist. D. Reach far when lifting. Answer B. Using leg muscles and a straight back prevents injury during lifting. The aide notices expired food in the client's refrigerator. The correct response is A. Throw it away immediately. B. Report to the supervisor and get permission to discard. C. Ignore unless client is sick. D. Relabel the items. Answer B. Reporting ensures proper authorization and respects client property rights.